Okay, when you're expecting, some moments are just exciting and some are absolutely critical. This is one of the critical ones. We are going to walk through exactly what to do when your water breaks, step by step. And trust me, knowing this stuff is vital. So let's jump right in.
First things first, you need to forget everything you've seen in the movies. You know that scene where there's a huge, dramatic gush of water that floods the supermarket aisle? Sure, it can happen, but that's not the whole story. For a lot of women, it's actually a much slower, steadier, and totally uncontrollable trickle. And that's the key word here, uncontrollable.
I love this quote because it just nails the urgency of the situation. Think about it. That amniotic sac is this perfect, sterile shield that's been protecting your baby. The second it breaks, that shield is gone for good, and a very important countdown has officially started.
Now, let's be real. In the last month of pregnancy, with all that baby weight pressing down in your bladder, leaks happen. It's super common. So the first big question you're going to have is, how do I know for sure that this is my water breaking and not just, pee?
Well, here is the one test you can do immediately that will give you a clear answer. Try to squeeze your pelvic floor muscles. Do a Kegel, like you're trying to stop yourself from peeing. If the leak stops, it's almost certainly urine. But if that fluid keeps trickling out no matter how hard you squeeze, that's amniotic fluid. You just can't stop it.
So medically, this event has a name, PROM, which stands for premature rupture of membranes. All it means is that the sac has broken before contractions have really kicked in. And it's a good term to know because it confirms that even if you don't feel any pain yet, the delivery process has absolutely begun.
Okay, so you've confirmed it's your water. The very next thing you do is maybe the single most important observation you will make for your baby's immediate safety. I'm serious, this is a step you cannot afford to skip. And please, don't just grab an old towel or use something with a color or pattern. You have to put on a clean white sanitary pad or a maternity pad. That plain white background is absolutely essential because what you're looking for right now is a huge medical clue, the color of the fluid.
And this right here is the critical difference between everything's okay and this is an emergency. If the fluid is clear or maybe a pale straw-like yellow, that's totally normal. You might even see little white specks floating in it. That's just vernix, the coating that protects the baby's skin. But if you see any shade of green, brown, or a murky, thick yellow, that is a signal of a true medical emergency.
So what is that green or brown stuff? It's something called meconium, which is the baby's first bowel movement. A baby should never do this inside the womb. When it happens, it is a major, major red flag that the baby is in distress, often because of a lack of oxygen. And if the baby breathes in that thick, sticky meconium, it can cause a really dangerous, even life-threatening lung condition.
Okay, so now that sterile barrier around your baby is gone, your number one priority has to shift to preventing any kind of infection. This means there are some very, very strict rules about what you absolutely must not do next.
And let's be crystal clear about this. Do not take a bath or even a shower. Water can literally wash dangerous bacteria from the outside right up into the womb. Do not insert anything. No tampons, no cloth, no herbs, nothing. And this is a big one. Do not just wait around at home for the pain or contractions to start. The clock is already ticking.
So no matter what the fluid's color is, whether it's perfectly clear or that dangerous green, the final protocol is exactly the same. And listen, this one is not negotiable. This number, 24 hours, that is your new deadline. From the moment your water breaks, your entire medical team is officially working against a 24-hour clock.
And this is exactly why you can't just wait at home. After that amniotic sac has been broken for 24 hours, the risk of a serious bacterial infection developing inside the uterus skyrockets, and that can harm both you and the baby. The countdown started the second that water started to flow.
So let's just recap that final action plan one more time so it's locked in. 1. Note the exact time your water broke and check the fluid color. 2. Put on a clean white pad. 3. Do not bathe, do not insert anything, and please do not wait for pain. And number 4, leave for the hospital right away. This simple, clear plan is your guide to giving your baby the safest possible welcome into the world.